We're ready to go.
All right, can everybody hear me now through the TV?
We can hear you great.
All right, great. Hey, thank you very much for the help. Appreciate it. So again, welcome everybody to this press briefing with regard to the state's response to the pandemic. As always, we want to remind people that we need to take this very seriously. The cases we have are rising, the virus is in our community, and the hospitalizations are rising. As of last night, we had 905 folks that were in the hospital with coronavirus. And that represents about 20% of the overall hospital beds being taken up with those coronavirus patients. And over the last 7 weeks, that's increased from about 200 that we had on September 23rd to the 900 that we have today. So this is a very serious situation for our hospitals, and we all need to be a part of slowing down the spread of the virus. Right now, our hospital capacity is at 25%, ICU capacity is at 27%, and ventilator capacity is at 70%. As our doctors and nurses have gotten better at treating this, the ventilators have never really been a big issue, but we are concerned with regard to that hospital space and the ICU bed space. So we need people to please get back into the good habits that we had in the spring. And those good habits are all the things we talked about before with regard to making sure that you keep that 6 foot of distance between you and other people out in the public, that you wear a mask when you're going to be in those close confined spaces, you're going to be within a 6 foot radius of somebody else, washing your hands often, making sure you're staying home when you're sick, working from home if you can, shop just once a week, go to the store by yourself. And then of course, we're encouraging everybody to avoid the 3 C's, which is avoid those crowded places, close contact, and confined spaces. It's a virus, it spreads from person to person. We want to make sure that people are following the rules that we've laid out, using the tools we've given everybody to be able to slow the spread. We also know there's some new research out there and some new guidance from folks with regard to how masks protect both the wearer and everybody else from getting the virus. It cuts down on the amount of virus particles that are distributed out into the environment. So that's why masks work and are helpful in slowing down the spread of the virus. It's one of our NPIs that we use, along with that 6 foot of distance and washing your hands, staying home when you're sick. All these sort of things will help us make sure we continue to slow the spread of the virus here in our state. As always, we want to remind people that Test Nebraska is available, that if you sign up for Test Nebraska, that you'll be able to start looking for an appointment to be able to get tested. We have had nearly 500,000 Nebraskans, individual folks, sign up for Test Nebraska. And we have just encourage people to continue to look for places to be able to do that. We've delivered over 400,000 test results. And again, it's free to everybody. We don't sell anybody's data. This is just a resource out there available for people to be able to get tested. We encourage people to do that. And then of course, if you test positive, you need to isolate, which means staying at home and away from other people. If you've had a close contact, such as I've had, you need to quarantine. And that quarantine period is for 14 days. You cannot test out of a quarantine. So if you've had that close contact with somebody who does test positive, you need to stay home for 14 days to make sure you're not going to develop the virus and spread it to somebody else. So we really need folks to be able to follow those rules so we slow the spread of the virus. And again, I just want to remind everybody as well, when our local public health people or some of our contact tracers reach out to you about either that test positive or that close contact, please treat them respectfully. Remember, they've got tough jobs. Let's leave a little space for grace with regard to our public health officials. This is a trying time for everybody, and we just want to make sure that we're all behaving like Nebraskans, that we take care of each other, that we're doing the right thing. So please remember that as we go forward. Now, earlier this week, we had talked about the DHMs that I had put in place to help slow the spread of the virus. And I wanted to share with you some information about where we're going. So I mentioned we have about 905 folks in the hospitals right now with coronavirus. This represents about 20% of our hospital beds being taken up with those coronavirus patients. And we have been seeing a rise in those hospitalizations by about 25 patients a day or so. We want to remind people that, again, you got to follow these restrictions so that we can slow the spread of the virus to preserve our hospital capacity. And we're using that hospital capacity as the guideline for future restrictions that I mentioned yesterday, that we will need to take additional restrictions if we don't see a slowing in the spread of the virus and the slowing in our hospitalizations. So what I was going to share with you today is a chart that lays out what types of restrictions people can expect able to expect those restrictions. So Ryan, I think you're going to go ahead and put that chart up. Is that why I'm looking at you right now? That is. Okay. All right. So here's the chart. And for the members of the media in the room, we will be handing this out so that you'll have this as well. As I mentioned, we're about 20% of our hospital capacity right now. And that's why we have the restrictions in place with regard to extracurricular activities and all the other things and so forth. If we were to get to 25%, and at the current hospital capacity, that would be roughly something around 1,170 hospitalizations from coronavirus, then we will prohibit youth extracurricular activities below the high school level. And fan attendance will be the same as orange for the high school level, which means immediate family only, or households only for high schools. And for college, it will mean immediate family only attendance. And of course, staff would also be able to attend those college games. For bars will go to carry out, delivery, and drive-through only in a world where we hit that 25% threshold. So essentially, bars will be closed to that in-person experience. It will have to be carry out only. For restaurants, licensed restaurants will be able to do dine-in, but they will only be permitted to do it from 5 a.m. till 9 p.m. Masks will be required for public-facing staff. Patrons will be, of course, required to be seated. Parties of 8, 6 feet of separation, no games, no seating at counters or bars, and patrons can only have alcoholic beverages as long as they're having a meal. So this is very similar to what we did earlier in the spring. For churches will have to have, again, the 6 foot of separation, and we reach red, again, no passing of items between household units. For wedding and funeral receptions, 10-person will apply for receptions. Services must have 6 feet of separation between households. For indoor gatherings, we'll be going to the 10-person rule that we had earlier this spring. Outdoor gatherings will be going to a 25-person rule. So again, as you're thinking about your holiday preparation, if we hit the red, we will be limiting those gatherings to 10-person and 25-person. So please be thinking about that, about how you're going to be limiting your holiday gatherings as we come up on Thanksgiving. For gyms and health spas and so forth, again, 6 feet of separation between customers. For salons and barbershops and so forth, 6 feet of separation between customers and masks required. Schools will remain open. For elective surgeries, this is a DHM we're going to be going to today. So because we are in orange, we will be doing a DHM that will be limiting elective surgeries to that fall in the class of D or E as determined by the hospitals, that classification. Essentially, that means is any procedure, any inpatient procedure that can wait 4 to 12 weeks will be prohibited. So starting on Monday, we will, again, issue the DHM today, effective Monday. All inpatient procedures that can fall in that category of D or E, so essentially they can wait 4 weeks or longer, will be prohibited. It will allow for outpatient procedures. If we hit red, then we will be moving to the C category, which is really kind of the more recent ones that are less than 4 weeks, that if they can be delayed, they will be delayed. So if we hit red, we will be prohibiting inpatient procedures in the class C category. So again, right now we're in orange, and we're going to be issuing the DHM today that will prohibit inpatient procedures for class D and E. If we hit red, class C will be added to that. And then we'll continue to evaluate as we see what happens with our hospitalizations. Child care centers in the red. such will be able to continue to be open, but staff and volunteers and practitioners must use masks or other items to sufficient to cover an individual's nose and mouth when within 6 feet of the children for 15 minutes or more. And then with regard to public meetings, county board meetings, NRDs, and so forth, if we hit the red, then we will going back to virtual public meetings, such again as we had an executive order on the spring that will allow those meetings to happen virtually. Right now, they can happen virtually if they have members of the board who are quarantining or isolating because of a public health measure. Those members can attend virtually. If we hit the red, then we'll go to all virtual meetings for those public meetings. And one of the other things I want to emphasize is that if we get to the red, we will consider additional measures as well within the red. So there may be further restrictions once we get the red, but we wanted to lay out for you when we're thinking about putting these additional restrictions in, when we hit that 25% capacity of, or 25% of our hospital capacity being used by coronavirus positive patients. And that's when we'll take these additional restrictions. And then if that doesn't have the effect we need, then we will continue to put additional restrictions on while we're in the red with regard to things such as potentially restaurants, gathering sizes, selective surgeries, and so forth. So that is the announcement that we have today with regard to the additional DHM with regard to elective surgeries, and providing this table that shows what will happen, what the next round of restrictions will be based upon where we are with regard to how many coronavirus patients we have in the hospital. So with that, we're going to go ahead and move on into questions, which we've had some submitted. So Ryan, I think you're going to put me back on the screen, right?
Yep, you are up now.
Okay, great. So we had a couple of submitted questions from Grant Schulte. Grant Schulte from the Associated Press. The spring DHMs focused heavily on public spaces, but if informal and family gatherings are driving much of the spread now, are you concerned that DHMs won't be effective this time? Well, certainly we know a lot more about how the virus operates now than we did last spring. And folks have had an opportunity to see the tools that we have to be able to slow the spread of the virus, understand the rules that will help us slow the spread of the virus. So by putting these DHMs in place, what we're really asking Nebraskans to do is not only follow the rules when they're out in public, but also keep that in mind when they're in their informal gatherings as well. And again, this is something where we all have to be a part of a solution to be able to slow the spread of the virus and make sure we're preserving our hospital capacity. Our hospitals are in serious condition right now, and we do need all Nebraskans to step up. So these DHMs, again, are something that we've been talking about now for the past over 7 months. And so I'm encouraging Nebraskans to adopt the types of good habits that they had in the spring that helped to slow the spread of the virus. And that would include for those informal gatherings and those family gatherings. Andrew Zaki, can you ask the governor for an update on the state's effort to de-densify the offices? Yes, so I've been asking my cabinet members to de-densify their offices. And then Andrew also asks, how's the progress been on that, Ben? And then has there been any drop off on services or increase in waste times or anything like that? So to my knowledge, there has been no drop off in the service levels. There has been no increase in wait times. And we don't have specific data, Andrew, but talking with my cabinet members and my director of Department of Administrative Services, I think that broadly speaking, we're about 50% of the folks who are in the office at this point. So we have been able to de-densify that office space. And again, we're asking everybody to do the same sort of thing, de-densify your office space, work from home if you can. And Taylor, I believe you might have a couple of other questions that were sent in late.
We do. We have a couple questions from Annette at the Star Herald. She says health professionals in Scottsbluff are calling on counties and cities to institute their own mask mandates as a statewide mandate has not been issued. What is the governor's position on whether cities and counties can do their own mandates?
So with regard to state law, counties cannot issue their own mandates. So that would have to go through all of our local public health departments. And again, I think as I've talked about, I think we need to educate people on using masks. There's a lot of good information out there. CDC just came out and said, hey, wearing even a cloth mask will cut down on the amount of virus that is that you are potentially giving to other people, and cut down the amount of virus you may be bringing in. So that mask works both ways to protect you and other people. So we certainly want to encourage people to take that up and use them where it's appropriate. But counties cannot do that mask type of mandate. With regard to cities, Omaha, for example, has a home rule charter that allowed them to pass an ordinance. So other cities may have that. I would encourage them to consult with their legal advice on whether or not they actually have the authority to be able to do that. Obviously, if they don't have the authority, they can't do it, but they need to consult with their own legal advisor with regard to whether or not they've got that authority. And again, I encourage people to learn the rules around masking and oppose mask mandates.
Also, Manette asks, she says some communities are planning large gatherings for the holiday. What is the governor's position on these gatherings? Should communities have these gatherings in the interest of health and safety?
Yeah, I would discourage communities from having the large gatherings. And again, as I just laid out in our table with regard to if we hit that red zone, then we will be limiting those indoor gatherings to 10 people and outdoor gatherings to 25 people. So again, if you are looking to plan a gathering over the holidays or the next few weeks, I think it's probably just best that you replan that to be able to have smaller gatherings of different smaller groups rather than having one big gathering. So I really discourage those large gatherings.
Martha Stoddard at the World Herald wants to know if are there any specific guidelines that the state is issuing for informal gatherings?
Are there any specific gatherings that people are using for informal gatherings? We're not issuing anything for informal gatherings, but we do, again, remind people that we've given you a lot of tools on how to slow the spread of the virus. Keeping 6 feet away when you're in public. One of the things we've said is if you're going to have gatherings at your house, have them outside if the weather allows. Again, that it's not foolproof, right? That's what we did when I had dinner on Sunday night. We did our dinner outside because it was a nice evening. We thought we'd be able to take advantage of that. But if somebody then tests positive, you're all going to be, having to quarantine if you were within 6 feet of that person for 15 minutes or more. So again, we just encourage people to have smaller gatherings. Use our good practices with regard to wearing a mask if you are going to have those extended periods of time when you're not going to be eating or drinking, or if you're going to be have the opportunity to be outside, be outside. Those are all things you can do in your informal gatherings that will help slow the spread of the virus.
Julie Anderson wants to know if the governor will allow the local health departments to issue mask mandates now that we know they protect the wearer and those around them.
No.
Andrew Ozaki wants to know if we wait until we reach 25% to enact additional directives, won't that be too late to protect hospitals?
We've put together these guidelines in conjunction with working with the CMOs of the different hospitals. Certainly, if we think we need to adjust these, we will make those adjustments. But we wanted to lay out the guidelines for folks of where we are so that people could understand when they can expect additional restrictions if we don't slow down the spread of the virus. That's why we want all Nebraskans to really pitch in right now to be able to use the tools we've given them, follow the rules with regard to avoiding the 3 C's. All those things will help us slow the spread of the virus, limit your mobility, work from home, shop once a week, go alone when you go shopping. All the things that we learned in the spring about how to slow the spread of the virus. If we do those things now, we can avoid future restrictions. And if we don't, then we'll see continued more restrictions.
I think we're ready for questions from the room. Fred, do you have anything?
Just to clarify, the top line on this chart that triggers these various contingencies, that's the percentage of hospital capacity that is occupied by COVID patients?
So Fred's question is, in regards to the percentages at the top of the chart that we showed earlier, are those percentages are the percentages of staff beds occupied by coronavirus patients? Is that correct?
Yes, that is correct, Fred. So for example, at 905, we're roughly at 20%, puts us in the orange. And again, that will be variable based upon the staffed hospital and ICU beds that are available. So this will be a staff beds number. And maybe I should also clarify one other thing. When we cross the line, so it would just take 1 day of crossing the line to get into the red. To come back down to those other levels will take a 7-day average of being below that line to be able to get back to the next lowest level.
Also, you talk about returning to the good habits of the springtime, but
So Fred's question is, he says that you want to return to the good habits of the springtime. Have Nebraskans become relaxed about this over the last several months?
Right. Well, and I think I also heard about, or did the restrictions get relaxed? Obviously, the restrictions were relaxed, but again, if again you think about this virus spreading from one person to another person, it requires all of us to be able to be engaged in using the NPIs, those non-pharmaceutical interventions, throughout our regular course of our life every day. And I do believe that when we had tighter restrictions and earlier in the spring, we didn't know a lot about this. That were people paying more attention. I think that now we have to get people to pay more attention again, because we are seeing the rising number of cases and the hospitalizations. And that's why we are working on engaging people and why we're putting out this table, so people understand when will we hit that threshold of having additional restrictions, and again, soliciting their help in slowing the spread of the virus.
Brandon, did you have anything?
Yeah, you mentioned the fact that we could go even stricter than what we're seeing on this chart in the red. Any idea what that may look like if we have to take even further restrictions than what's listed?
So Brandon and Andrew Ozaki's also texted something similar. They both would like to know whether, if you had to go more restrictive than what's on the chart, what would that look like?
So if we have to get more restrictive than what's on the chart, what would that look like? Some of the things I mentioned earlier with regard to restaurants, for example, or elective surgeries and those sort of things, we may have to go more restrictive on those types of items. Or maybe high school sports, for example.
Don Walton has a question for you. He asks, have you considered whether issuing those additional restrictions that you have on the chart now might prevent reaching the red zone?
Well, we want to take this a step at a time and, again, encourage Nebraskans. What we really need is to have Nebraskans be engaged with slowing the spread of the virus by actively using all the different non-pharmaceutical interventions we have, all those tools that we have. And if we do that, then we won't need to take those additional restrictions. If we slow the spread of the virus, if our hospitalizations start to decline, then we won't need to take those additional restrictions. If we put those in, if we don't slow it, then we'll have to put those additional restrictions in place. As we've said, oftentimes it takes time for these things to have that impact, and we want to give Nebraskans the opportunity to start using those before we put additional restrictions in place.
Martha Stoddard sent in another question. She asks, at the current rate of increasing hospitalizations, how many days will it be before Nebraska hits the red?
Well, again, it really depends upon if we can slow down the spread of the virus and really bend this curve, as we were talking about yesterday. I think we've been adding on hospitalizations at roughly 25 a day. So if we keep up that rate, or if it goes up higher, it'll be here sooner. If it goes lower, then we may not reach it at all. So it's really difficult to predict, Martha, because we just don't know how many hospitalizations we'll add. And if Nebraskans really get engaged with this, we can knock this all down together and avoid going into the red.
Fred?
Governor, you said counties don't have the authority to mask mandate. Cities may, they have to investigate that. But public health districts can do it if approved by HHS. It's been reported that the central district wanted to do that and HHS said no. Is that true? And what's your attitude towards public health districts who want to do that?
So Fred's question is in regards to mask mandates and health districts, and there's one health district that may have wanted a mask mandate that was not able to get it, and he wanted your comment on that.
Yeah, so again, I'm against mask mandates, and so the state's not going to approve that for local public health directors or local public health districts to do that. And my position on this has been very clear, and something that we've kept maintained throughout the entire pandemic going back to last spring. And I really want to emphasize that, masks work, but they're just one tool, right? We've had mask mandates in Omaha and Lincoln, and we see rising cases in Omaha and Lincoln as well. We got to have all the NPIs being used. It's got to be that Swiss cheese that we talked about in the spring as well, all the different layers of NPIs. We have to not only have people wearing masks when they're going to be within 6 feet of each other in public, but also try to keep more than 6 feet away from each other while they're in public. Making sure they're washing their hands often. You're only going to the store once a week and you're going by yourself. working from home if you can, washing your hands often. These are all the other parts of the NPIs that will help us make sure that we slow the spread of the virus. Masks are one tool, and they're a tool that's important, but it's not the only tool. And as I mentioned before, I'm against the just doing the broad-based mandates, in favor of educating people on how they use the mask. Because again, folks, even if we get a vaccine next month and it is effective, it's still going to take time for those vaccines to be rolling out. And so we're going to need to continue to have these good practices as we go into next year to be able to slow the spread of the virus and preserve our hospital capacity.
Charlie Brogan is asking, what has the state heard from the federal government about vaccine availability and the state's role in distribution?
So with regard to vaccine availability, again, we're expecting to have a vaccine next month, but of course, there's no guarantee with that. The FDA would still have to approve that. The vaccines that we get will be distributed through our Vaccines for Children program and distributed through our local public health departments. And the local public health departments will work with clinics and so forth to be able to get that out the way they would do regular vaccines. The priority for this will be, again, healthcare workers, long-term care workers, first responders, and then going into vulnerable populations, older people with underlying health conditions, minorities, and so forth. And again, this our plan has been published since the middle of October on the Department of Health and Human Services website. You can go to dhhs.ne.gov and go search for it. So it's all laid out there for anybody to take a look at and see how we're planning on distributing the vaccines.
Julie Anderson has a couple follow-up questions. She says hospitalizations lag new cases by 2 to 3 weeks. Is it too late to head off higher hospitalizations?
I'm sorry, can you say that again, Taylor? I couldn't quite hear you.
Yep. Julie Anderson is asking about hospitalizations. She's saying that they lag new cases by 2 to 3 weeks. And is it too late to head off higher hospitalizations?
So again, what we're doing is laying out for folks, if we reach different thresholds, again, based on hospitalizations, what additional restrictions we will see put in place, and giving Nebraskans the opportunity to be able to, again, take advantage of the fact that we've got these tools, we know how they work, so please use them, all of our NPIs, to be able to slow the spread of the virus. And if we can slow the spread of the virus, we can avoid further restrictions.
She also wants to know, is the capacity calculation for the hospitals based on physical beds or staffed beds?
So all the capacity calculations are based on staff beds. That's why you might see, if you look at our dashboard daily, you'll see that number fluctuate. For example, over the course of the summer, a lot of the beds capacity was roughly 4,000 beds or a little bit more. Now it's 4,500, 4,700, but that number will fluctuate based upon staffing. And again, so we'll use that staffed beds as the indicator based on for those percentages on what level we're going to be at, whether it's going to be orange, red, or a lower level.
Jeff Robb from the World Herald asks, aside from a mask mandate, why will the state not approve local health departments setting their own DHMs?
Well, again, as I said, masks are just one tool that we have. They're not the only tool we have. We have lots of other tools we want people to use. We should educate them on all of them. And as has been very clear all along, I'm against a mask mandate.
And then Andrew Ozaki says, why do you think all of the pleas you've made in education you have provided hasn't worked?
I'm sorry, Taylor, can you say that again?
Andrew Ozaki is asking, why do you think that the pleas you have made in education you have provided haven't worked?
I still couldn't hear that last part. Why do I think what?
Andrew Ozaki's asking, why do you think that the previous pleas for the public to change their behavior haven't worked?
Well, so if I'm going to repeat that back, why do I think that the previous DHMs we've done have not been able to slow the spread of the virus and our hospitalizations? Is that accurate?
Sure.
So what we're looking, again, this is where we need all Nebraskans to be engaged. And I'll just give you an anecdotal evidence of one of my staff members saying that in their social gatherings, there wasn't a widespread awareness that the hospitals were in serious condition the way they are. So I think it takes time to get the word out. We have to educate people, and we need to be able to get their help and be able to slow the spread of the virus here. We need all Nebraskans to pitch in here, whether it's using the NPIs or going to Test Nebraska. These are all things we can all do to be able to slow the spread of the virus. It does take time to educate people. Got to get the word out there. But by getting that word out there, getting people engaged, that's how we're really going to get the biggest effect on slowing this down.
Do you have other questions from here in the room?
Why use the percentage of staff beds occupied by COVID patients as the trigger? I mean, if there's like a flu outbreak or anything that would stress the hospital capacity, why not use that as the trigger?
So Fred's question is, why do we select the trigger of coronavirus patients as a percentage of staff beds instead of incorporating other factors such as a flu outbreak when considering restrictions?
Yeah, with regard to the coronavirus, obviously this is a thing that's putting the pressure on our hospital system right now. As we have more patients with coronavirus, that does mean that some of those elective surgeries, for example, need to be delayed so we can accommodate the coronavirus patients. So that's what's really driving the increased use of our hospital system right now. And if you look at, for example, what happened in the Southern Hemisphere, they really did not have a severe flu season because the NPIs that we use to slow the spread of the coronavirus work for the flu as well. Obviously, if there was some other pandemic or another virus that was starting to really impinge upon our hospital capacity, we might have to rethink that strategy. But right now, it's really coronavirus that is driving the increased use of the hospitalizations.
Jeff Robb from the World Herald has a follow-up question. He says local DHMs can include a lot of different steps. Why will the state not approve of local DHMs?
So again, we're putting together a plan in the state that we work in cooperation with the local public health departments. We know a lot more now than we did last spring. And frankly, the cases that we're seeing rising across the state are all across the state. It's not just in one locality, which is different from what we had earlier this spring, where there was kind of a spread across the state in different areas at different times. What we're seeing right now is that it's pretty broad-based across the state. And so that's why statewide is more appropriate.
Any other questions?
I wonder if Dr. Anton could give us some details about the situation in hospitals in various parts of the state and whether people are being transferred out of state or within the state.
Fred is going to ask Dr. Antone about hospital transfers and the overall hospital situation.
All right, great, thanks.
Just to repeat their question again, Fred was asking about sort of the state of the hospitals or the situation throughout the state of the different hospitals. And again, we keep in contact with all the major hospitals and even some of the critical access hospitals here throughout the state. So as I mentioned yesterday, the Panhandle, the Scottsbluff Hospital, which is the Regional West Hospital out in Scottsbluff, did reach their highest level of COVID positive cases this week. And they have asked for assistance for some of the surrounding hospitals, such as even their critical access hospitals, the North Platte, Great Plains Hospital area. Whether we're taking transfers in from other states, sort of our, from out of state? Or we're not sending patients out of state at this time, to my knowledge. We have accepted some patients from, let's say, like Kansas, that some of the hospitals have already had relationships with those transfers, so we feel an obligation to take care of those patients too. But in general, we're trying to just transfer patients within our state at this time. The other hospitals, Fred, the main hospitals are Regional West and Scottsbluff, Great Plains Hospital and North Platte, Good Samaritan Hospital and Kearney Regional and Kearney area, St. Francis and Mary Lanning in that area, and Faith Regional and Columbus Hospital. I keep in contact with them every day. They've been very stable, except for the Panhandle, really increasing here within the last week. And then, like I said, some of the hospitals have really stepped it up to help Regional West at this time. So,
Other questions? All right, well, seeing none, Governor, do you have any closing comments?
Again, I just encourage Nebraskans to please get engaged with our non-pharmaceutical interventions, the tools we've given everybody with regard to slowing the spread of the virus. Again, keeping that 6 foot of distance between you and other people in public, wearing a mask, washing your hands. Please, if you're sick, stay home. We've had, again, anecdotal stories of people either going to work sick or sending their kids in sick and then having them tested afterward and coming back positive. Well, if you were showing symptoms, you shouldn't be going anywhere. You should be staying home. And if, of course, if you test positive, then make sure you're following our protocols with regard to isolation. We also, again, want people to, do the things they did before with regard to limiting their mobility, working from home if they can, go to the store once a week, go by yourself, don't take the whole family. These are all things that will help us slow the spread of the virus. And again, folks, if we can slow the spread of the virus, we can avoid further restrictions. And if we can do that and preserve our hospital capacity, that's what will allow us to be able to start taking some of these restrictions off. So please help us all out. And again, with regard to those holiday gatherings, please keep it to small family groups. Again, I know everybody wants to see their family at the holidays, but really keeping it small is what is going to be best for slowing down the spread of the virus and avoid those large group gatherings. And with that, again, thank you very much, everybody, for attending our press briefing. We will have additional briefings Monday at 10 a.m. I think it's Tuesday at 2 p.m. And then Thursday, 10:30, we will be doing the virtual kickoff of the public awareness campaign that some of the consortium of folks have gotten together to do. Taylor, did I get those press briefings right?
That is accurate.
All right, great. Everybody, thank you very much. Appreciate it. Have a good weekend.